everybody. My name is Joy
Hi, I'm Dr. Nagpal.
from Bella Medical Aesthetics, and today we're going to talk about our non-surgical penile size enhancement procedure, also known as the Upsize procedure. So I just have a few questions for Dr. Nagpal, commonly asked questions that people want to know before they get the procedure.
Absolutely. Nobody wants to go in blindly because this is not a very commonly done procedure, so they want to know what they're in for.
So what is the Upsize procedure or the non-surgical penile size enhancement?
So Upsize is just the name of the company, but it is the fillers that we do to enlarge your penis size. We can increase the girth and not the length because I have to have a tissue to inject in. So, you cannot inject when there's nothing. It's a very rewarding procedure. People have been very happy about it. And so you need 6 of them to see some difference. Okay. And it's a very painless procedure.
So what about it makes it non-surgical or non-invasive?
I cannot say it's completely non-invasive. It's minimally invasive because you're still putting a needle. It is done with a cannula. You make one hole with a little needle and then you put a cannula through it and go the entirety of the length. And the size, how much you're going to enhance is, of course, depends on the size and on the length, how many, if it's a long penis, I will need more fillers. There's no incision. It's just like getting your fillers in the face or under the eyes or the lips.
Okay, great. And who is a good candidate for the Upsize procedure?
And anybody who's not happy with the size, or anybody who wants to enhance it, anybody. But if you have had surgery on that area, it makes it difficult. If you have any deformities, major deformities, it makes it a little bit more difficult. The scarring and all will make it difficult. Otherwise, if you're on big major blood thinners, that's a problem because you will really bruise, because it's not just 1 prick or 2 pricks, there are more than that. So that will make you some swelling, and I would say if you can get off the blood thinners for a while and then do it, it's worth it. Then it can be done. Blood thinners, I would not do this procedure on you. Something like aspirin, you can be off for 2-3 days and you're fine. I would also stay away from Motrin for a week or so, Advil, Naproxen, any kind of stuff that makes you can make your blood thin. I would stay away from them at least for 3-4 days. 1 week is ideal.
Good to know. And is there a minimum amount needed for there to be a significant difference?
Yeah, significant is very different in different people's eyes, but to have any kind of change, you need at least 6 fillers. Like, it's a large area. I tell people to get 6 at least, and then see if they want more, then we can always put more. We like to break it up at least in 2 days, like maybe 8 today and 4 in 2 days or tomorrow, just to give time for the skin to adjust to that. But I think if you're new to this, it is better to get 6. And we have a package of 6 now and 6 in 14 months because it normally lasts anywhere from 14 to 16 months. You'll see gradual decrease because it gets absorbed. You have to really follow the aftercare instructions in a very strict manner because you can develop some problems and you don't want that. It's a very good deal because one filler itself is $750. You are getting a good value with that. Now, if you want to decide between the first and the second session that you do want more, then you get it at a discounted price, and we can always talk about it because the prices change.
And I heard you say that over time, the results diminish a bit. So would this be a permanent or a semi-permanent method of increase?
But this is semi-permanent. 14 months is a good. Otherwise, you just want to get implant. It is more painful. There's a lot of downtime, and if you don't like it, then they have to do a surgical procedure to take it out again. you have to see how comfortable you are to get something like that, as opposed to something that over time is going to go away, and it also can be dissolved.
Okay, and another common question people ask as well is how exactly is the size changing? Is that through girth or length?
The girth only. It cannot increase the length, although I've seen in measuring many times you do see some increase. But that's in the non-erect penis anyway. I always tell, don't expect any increase in the length. It's not that okay, there's 4 inches and I want 6 inches. That's not the role of a filler. I want to actually also say that guys, don't feel guilty about it. Women in your life get nails every other week, this design, that design. We get our hair, we want different styles. So we spend a lot of money.
Yes.
You guys deserve something too.
Absolutely. So thanks for tuning in, and we'll catch you all in the next video. Take care.